Hi, Dr. Daniel Klauer here with the AACP talking about our annual meeting in October in South Bend, Indiana. So I have Dr. Abdel-Fattah here, Reda, a good friend of ours and a good friend of the Academy. He's going to be speaking this year on some of the legal implications of what we as TMJ and sleep practitioners need to have under wraps, understood, and well documented. So Reda, thanks for making the time. Why don't you share with everyone here a little bit about who you are, what you do, and what you're going to be talking about this year at the annual meeting?
My name is Reda Abdel-Fattah. I am a dentist in Boca Raton, Florida. I am a specialist in orofacial pain. I am a diplomate of the American Academy of Craniofacial Pain, Orofacial Pain, Craniofacial Dental Sleep Medicine, and Dental Sleep Medicine. I have lectured extensively. I have authored many books and articles. I have been in practice for over 40 years, and I am going to be lecturing on the preventive measures in documenting the TMJ injury cases. As a matter of fact, the documenting any case is different than documenting an injury. You have to have certain elements in taking the history, performing the examination, requesting diagnostic aids, and formulating the diagnosis itself. That's a little bit different than the usual regular chronic pain or acute pain. Also, the treatment itself. What kind of treatment? You have to substantiate your diagnosis and you have to justify the treatment you are offering. One other thing that we might be adding, which is causal relation of the injury to the event, which is usually legally required if the case is going to the court or there is some litigation. You may be also required to determine the permanent impairment rating, and that will be in the report. The most important thing in a legal case, usually the report, which is the initial report, interim report, and then the final report. The initial report usually about your history, your examination, your evaluation, diagnosis, and treatment. Then the interim, how the progress is happening. Then at the end, the final report, you summarize entire sequence of events, and then you are putting the permanent impairment, the projected treatment plan, what the patient is required to do later on, and so forth. So everything counts in these reports, and your examination as well as a history, as I mentioned before, have to be done specifically related to the injury.
Well, that sounds like a ton of information that we need to be well informed on and be prepared to put into our documentation. As you know, a lot of us practitioners put our heart and soul into figuring out what's wrong with these patients and trying to help them, but we got to make sure we protect ourselves so that when it comes down to it, we have the right stuff in the chart to make it easier for us when it's called upon. So we look forward to seeing you. Thanks for agreeing to come out and speak to us. And as parting words, what would you say your favorite thing about the AACP is over the years you've been involved?
Well, as you know that I have been to many organizations, I still a member and diplomate and for many organizations. And of course, every organization has its merits and beautiful things. The AACP is characterized by the clinical type of information. I feel comfortable being between my friends and colleagues in the AACP. I feel that I gain many information, and I tell you, I owe the giants in the AACP who started the whole organization a lot, because I got trained on their hands and I actually stood on their shoulders in order to be where I am now.
I think that's a great sentiment about the Academy. I agree with you and look forward to standing on the shoulders of people like you. Thank you for your time so much, Rita, and we look forward to seeing you in October.